Hello, this is Taekyun Kim. Today I'd like to talk about the Lyme disease and the importance of mental and emotional approach on the treatment point of view. As far as I know, still lots of doctors and scientists are trying to approach many medical symptoms and disease without deeply concerning about mental and emotional aspect of the patient. For example, when you visit your GP for gastritis, your GP normally prescribe some tablet simply. Not many of them ask how you felt at the time of the tummy discomfort, what happened by the time of the feeling uncomfortable, or if you have any stress when you have a tummy aches, etc. They normally do not have any interest in this kind of issues. But many of our symptoms and disease can be caused by our mental or emotional issues. According to my clinical experiences, I can see that the gastritis can be caused by many kinds of mental or emotional issues, such as argument, exams, preparing an interview, relationship among colleagues, intensive competition, financial situation, and worrying about one's future, etc. Our body and mind are deeply and closely related, and they are influencing each other physiologically, biochemically, and energetically all the time. However, many doctors and scientists, even a lot of complementary medicine practitioners, still keep focusing on how to kill the bacteria to improve the symptoms of the Post Lyme Disease Syndrome. They seem to believe that they can improve the symptoms of Lyme disease by killing the bacteria. On the other hand, they tend to underestimate the importance of the mental, emotional aspect of the treatment. Interestingly, I have seen many of my Post Lyme Disease Syndrome clients have mental and emotional issues or trauma, such as addiction, family issue, childhood abuse, divorce, domestic violence, and so on. Most of them had been suffering from these mental emotional issues even before they had Lyme disease, and sometimes their mental emotional issue or trauma looks much trickier problem than their physical symptoms, because they are getting much weaker and weaker mentally, emotionally, by losing many kinds of relationships among friends, partners, family members, husband and wife, and so on. Therefore, they used to feel lonely quite often and isolated completely. This can make their symptoms even worse easily. Now we can ask a question. How can people maintain their mental and emotional condition stable? There are lots of different methods out there, but here I want to introduce 3 very practical tools to make the mental and emotional status more sturdy and solid. They are Tai Chi Chuan, Qigong, and cross-crawl exercise. I believe that people will get lots of clinical benefit when they practice these exercises every day diligently. Recovering from the post-Lyme disease syndrome will be a long journey. It normally takes 3 to 6 years of time for people to get back to their previous normal life. Bear in mind, please. By the way, there are always 2 most dangerous ambushes during the process of the treatment. These are the frustration and the impatience. As long as the treatment is right for the people, then they need to be patient until they come back to their previous ordinary life. Thanks for watching this video.